My name is Andrew Rosenberg. I'm the Chief Information Officer for the University of Michigan Health System. I'm also an internist, an intensivist, and a cardiac anesthesiologist who also happened to do 2 years of a research fellowship as a Robert Wood Johnson Scholar. So I have a number of different clinical and research backgrounds that have helped me in this work. In our very complex work at the University of Michigan, we have engaged with Deloitte on a number of fundamental initiatives. For me, the one that was most fundamental was our implementation of electronic health records. And the interesting piece is that we were required by the regents of the university to partner with a strategic partner. And so we went through a very competitive, very open process to find that partner. And in the end, Deloitte absolutely just came out on top. I mean, I remember I was part of the selection process, and I remember when the team from Deloitte came in, there were a number of very interesting things that they did that just so showed that they were different from the other groups. And at the time, I didn't really know Deloitte. I didn't know the individuals, so it was refreshing. Since then, we've had several other, frankly, competitive RFPs for partners, and we continue to find Deloitte continues to come out on top. Probably the most important thing I can say about what Deloitte did to help us is that if you walked into any of our teams working on our implementation of EHRs, electronic healthcare records, some of our large value and margin improvement projects, enterprise analytics, identity and access management, several of these large projects where individually Deloitte was helping us out, you would not know who was a Deloitte employee from a vendor employee, from a University of Michigan employee. Deloitte helped us create those teams. Deloitte brought methodology. Deloitte brought, obviously, expertise. But they were able to blend it as part of our team in a way so that the team was indistinguishable. And I talk about that a lot because I think it reflects partly our culture, but it clearly reflects Deloitte's culture as well. And in doing that, they formed and helped form our teams so that we could use local knowledge with the supporting structure of the Deloitte experts and the Deloitte methodology. And we would not have been able to implement our EHR projects without Deloitte.